Hello and welcome to the Abuse, Neglect, and Exploitation module of the Training for Certification of Community-Based Living Arrangements in the state of Nevada. This training and the certification process overall is handled by the Department of Health and Human Services Bureau of Healthcare Quality and Compliance. The objectives of this training module are to increase awareness of indicators of abuse, neglect, and exploitation, and to understand your responsibilities as CBLA providers for managing and reporting suspected abuse. So why are we talking about this issue? Well, whether young or old, persons with disabilities are at increased risk for abuse and neglect when compared to those without disabilities. So therefore, reducing this risk is the responsibility of us all. Nevada law defines abuse as any willful or unjustified infliction of pain, injury, or mental anguish upon a client. Abuse can be physical, sexual, verbal, psychological, or financial in nature. And abuse is also considered to include excessive force, unauthorized use of physical, chemical, or mechanical restraints, or the use of seclusion in violation of federal law, and it includes any type of aversive intervention as defined under Nevada revised statutes as indicated on the slide. Nevada law defines neglect as any act or omission to act which causes injury to a client or which places the client at risk of injury, including, but not limited by the failure to establish or carry out an appropriate plan of treatment for the client, provide the client with adequate nutrition, clothing, or health care, or provide a safe environment for the client. Now that we've gone over these technical definitions, you need to know that actions that may not be legally defined as abuse, neglect, or exploitation may still be experienced negatively by your clients, and these actions shall be treated with the same level of seriousness. As we mentioned before, the types of abuse and neglect can be categorized as physical abuse, verbal abuse, psychological abuse, exploitation, and financial abuse. We'll go over each of these types in more detail in the coming slides. First, let's talk about physical abuse. Physical abuse is any unwanted physical contact or action, for example, hitting, slapping, punching, kicking, pinching, etc. And this is whether or not bodily harm or trauma occurs. Next, let's talk about verbal abuse. Verbal abuse can be described as any use of oral, written, or gestured language by which violence occurs. And this includes derogatory terms to describe a client who has disabilities. Next, let's talk about psychological abuse. Psychological abuse can be described as humiliation, harassment, threats of punishment or deprivation, sexual coercion, or intimidation, whereby individuals suffer psychological harm or trauma. Now let's talk about exploitation. Exploitation is any illegal or improper use of a client's funds, property, or assets that results in monetary, personal, or other benefit, gain, or profit for the perpetrator, or results in monetary, personal, or property loss for the client. This includes borrowing a client's money, taking a client's medication, asking or coercing gifts from clients, a client doing work for staff such as washing your car, improper use of a client's social security number or funds, and improper use of funds belonging to the client or diversion of state funds intended for client use. Next, let's talk about reporting of suspected abuse, neglect, and/or exploitation that you might see as a CBLA provider. CBLA providers are considered to be mandatory reporters, and that's because CBLAs receive payment to provide services to vulnerable persons, which is defined in Nevada revised statutes as follows. A person who is 18 years of age or older who suffers from a condition of physical or mental incapacitation because of a developmental disability, organic brain damage, or mental illness. Or a person who has one or more physical or mental limitations that restrict the ability of that person to perform the normal activities of daily living. The bottom line here is that if you know of a case of abuse, neglect, or exploitation, you need to get involved. You should intervene immediately to remove and protect your resident from the alleged abuse. And in cases where acute behavior cannot be effectively managed, an alternative arrangement should be sought immediately to protect everyone involved. And then in cases where chronic behavior cannot be effectively managed, an alternate environment, such as an alternate living or working environment, should also be considered. So to bring this discussion full circle, what are your responsibilities as a CBLA provider? Well, your responsibility upon observing, hearing of, or suspecting client abuse, neglect, and/or exploitation is to submit an incident self-report to the Bureau of Healthcare Quality and Compliance immediately. And of course, depending on the severity of the allegation, the proper authorities should be notified immediately as well. If there's an incident of suspected abuse in your facility, you must submit a self-report form to the Bureau of Healthcare Quality and Compliance. To access this online self-report form, refer to the NV eLearn webpage for this training module, or pause the video for a moment to write down the link address. When you address this issue in your facility policies and procedures, your employees should know that any act of abuse, neglect, and/or exploitation of a client shall result in disciplinary action up to and including termination. As an employer, you should be training all of your staff on abuse, neglect, and exploitation prevention, identification, and reporting requirements in accordance with those same policies. And we recommend that CBLA providers immediately report any allegations of abuse, neglect, or exploitation to the authorities to help you mitigate your own risk of prosecution. You've reached the end of the module on abuse, neglect, and exploitation for community-based living arrangement certification with the Nevada Bureau of Healthcare Quality and Compliance. Next, you'll take a test, and when you pass the test, you'll be able to print and/or download a certificate of completion, which you will need to submit with all your other paperwork for certification.